and good evening. My name is Marisa Salisbury, and I'm the host of the Public Health Link. I am very excited to be bringing to you this weekly webcast that's going to showcase public health topics. So basically, the format will be the same every week. There will be three main topics. There will also be a tech corner, which will feature public health technology, an upcoming public health event, and what I'm referring to as the pH meter. But the pH meter in this is going to mean public health meter. There will be a scale of what's acid or the acidity and alkaline. However, it's in the form and in the realm of public health. I am excited not only to be providing you a means of public health information in the format of a newscast, but I'm really hoping I provoke some interest and discussion, that you'll look up additional information, discuss it with your neighbors, your friends, your coworkers, the public health topics I'm going to bring up, which brings me to a really important aspect of this webcast. At the end of every show, I am actually going to show you my resources. I am very confident in the information I'm providing. The places I receive my information from are definitely, they're solid. I'm not concerned at all. But I really would like you to be able to say, oh, that's interesting. How can I apply that? So you can actually go to those places yourself. The whole point to me, I should say the largest point to me of public health, is if the information is provided in the right way, it empowers people to see how they can apply it in their own everyday lives. So this webcast is not going to be just for those in public health. It's not going to be for just those in the medical field, and not just for those in the veterinary field, and I'll get to that, why I'm saying it in a moment, but also for community members, stakeholders. You know, you're looking at it and going, oh, that's interesting. I'm going to have to ask my doctor about that, or, oh, I've never heard of that. Let me see what I can do so that I can better my health or my children's or my neighbors or whatever part of the community that you participate in. Now, I mentioned a moment ago about veterinary medicine, because part of this webcast is also going to have moments of One Health. And maybe this is the first time that you've heard of One Health. One Health is the understanding that for an environment or niche to be healthy, you have to have collaboration from human health, veterinary medicine, and environmental sciences. And if there's any way we can showcase that, it's with COVID-19, right? Because this is a disease that came out of wildlife and spread through humans. And now there's also a concern of the fact of the animals that we're able to transmit it to. And I'm going to, actually, that's part of one of my themes, is a website you can actually look up some interesting information about SARS-CoV-2, or the virus that causes COVID-19, with animals. So again, welcome. I'm excited to be bringing this, the very first episode of the Public Health Link. I hope you enjoy it, and thank you for stopping by. On this installment of the Public Health Link, we're going to talk about 9/11 and the lives that were lost and that we continue to lose from that terrorist attack. We're going to discuss how New York had declared a state of emergency with polio, and we're going to talk about the new SARS-CoV-2 reporting tool and website created by the United States Department of Agriculture. But first, on September 11th, 2001, that day will forever be etched into the fabric of the United States. Quoted from the 9/11 Memorial Museum, the attack killed 2,977 people from 93 nations. 2,753 people were killed in New York. 184 people were killed at the Pentagon, and 40 people were killed on Flight 93. Over 2,900 people lost their lives while working in their office, taking a flight, and serving and protecting others, tasks that we would think of as everyday mundane, taking a flight to see a loved one, sitting in an office working. Times we would have typically ever thought of those moments before. Since 2001 attack, thousands more people have died as a result of 9/11 or living with a health condition attributed to their assistance with 9/11. More than 400,000 people responded to the injured, retrieved the lost, and cleaned up the devastation, a process that didn't officially conclude until July of 2002. Many people worked without any respiratory personal protective equipment. That equipment did not arrive to ground zero until approximately a week after. A fraction of those 400,000 people, about 112,000, have registered for services and assistance in the World Trade Center Health Program. So this is a program that's set up to assist with the physical health, the mental health, substance abuse that's associated with those that have responded to 9/11. That could be first responders, construction workers, anyone that have participated and worked to rescue lives, retrieve lives that were lost, as well as to clean up the devastation. Like I said, it took almost a year. It wasn't until July of 2002 that it was declared as having been concluded. So lifelong attributable ailments have included numerous forms of cancer. So those that have responded to 9/11 have a 30% higher cancer rate than the average American. And the websites which I provide to you at the end of this episode give you additional information. I hope you do look it up, that talks about forms of cancer that they were not expecting to see. Thyroid cancer, for example, was a lot higher than what researchers had expected to see from those that had assisted with 9/11. There's respiratory diseases, gastrointestinal maladies, mental health needs, and substance abuse. As we pause for those that lost their lives in 9/11, let's also support those currently living with health conditions due to the response and effort. If you know of anybody that has responded to 9/11, whether it was, as I said, the first responders or the construction workers, please don't hesitate to tell them about the website that is from, it's a program that's set up from the federal government that can assist with any kind of health-related issues. The World Trade Center Health Program. There's some hospital systems that have set up specifically. Mount Sinai, New York, has a system that's specifically set up for those that responded to 9/11. And again, it's not just the physical ailments, it's the mental health, it's the substance abuse. Any of those situations and all of those situations need to be treated. And the links are provided at the end so that we can help support those that are living with disease that are from that awful terrorist attack, that awful day. So New York this week had declared a state of emergency in regards to polio. Now, polio was a disease that it was believed to have been eradicated from the United States. So the fact that it's back here is not a good thing. And the one thing I'd like you to keep in mind, as I'm going over this information, is that disease transmits at the rate of travel. So we are a global society. And although this focuses New York because they're currently have identifiable cases, now that we know they're here, we need to be looking at what all of us can do to make sure that we try to keep polio out of our communities. So on July 21st, a Rockford County resident was diagnosed as having paralysis attributed to poliovirus. Polio, which is a very contagious virus, can spread from someone who's asymptomatic. So this is a person that's not showing symptoms. We know what a problem that can be with COVID, because the biggest concern with COVID and the biggest transmission factor is the fact of people being able to transmit that disease without having any kind of symptoms. The virus is spread through direct contact with the fecal-oral route, so such as hands contaminated with fecal matter if someone doesn't wash their hands after using the bathroom, and mouth-to-mouth saliva. Now, up to 90% of people will not have any symptoms or mild, okay? And 25% will have flu-like symptoms. But the concern are those that have irreversible paralysis. So even if, let's say it's a situation that you yourself, maybe could be your immune system's healthy enough, you don't respond in a way that's going to be one of those that are going to be paralyzed. However, you could be an asymptomatic person that gets it and gives it to someone who isn't so lucky. So what can we do about it? Well, before we talk what we can do about it, let's talk about why, we may be in this concern or in this situation. So the R naught number, so that's R0 number, called R naught, means this is, if we say the R naught of polio, This is how many people a person with polio can transmit or give that disease to. Well, it can be 5 to 7 people. So that R naught number for polio means that one person with polio can transmit that disease to 5 to 7 people. That is a big number. I mean, that's a big range. And that's in certain circumstances, in the average circumstance. So it's scary to think how quickly this disease can spread. And polio has been detected in wastewater. It's been detected in the wastewater of New York counties, Long Island, Nassau County, Sullivan, Orange, and Rockland. Now, why that's important is we can't look at wastewater and go, oh, 50 people have it. There's no way to give a definitive number. But the fact that it's detectable is concerning because it means there's enough concentration of it that it can be found in wastewater. That's not good. Okay. And one of the concerns, the facts of the vaccination rates in those counties. So the vaccination rates range from 59% in Orange County to the highest being in Sullivan at 62%. Those counties where it's detectable in the wastewater. Well, by the governor declaring a state of emergency, that means there's more resources, there's more money, there's more options. And what does she want to do? She wants to get out vaccines. This is a preventable disease, and it's preventable through vaccination. So the goal is to vaccinate, especially in these counties that are already showing wastewater. They want to reach a vaccination rate of 90%. That's the goal. Well, when you talk about, having 59% Orange County, there's some room there. There's some work that needs to be done. So by declaring a state of emergency, that allows for more funding, more resources to go into those areas so that more vaccines can get out to more people. So according to New York State Department of Health, all New Yorkers who are unvaccinated, including children by 2 months and older and those who are pregnant, and people who have not completed their polio vaccine series previously, should get immunized right away and ensure they are up to date with their polio immunization schedule. Now again, the focus is New York. However, disease transmits at the rate of travel. So we are very global. Although the focus is it being in New York, it could easily end up going to anywhere else in the United States. So I highly recommend, if you're not sure whether you're vaccinated for polio or that you're up to date, reach out to your local health department. Reach out to any agency that keeps track of your vaccine records to see what you can do, what you need to do to get yourself vaccinated. Because in this case, of course it's important. I don't want you sick, but you don't also want to make someone else sick that could become very ill from it. My mind thinks about when I was a child and I remember first seeing the pictures of the iron lung. Scary. I definitely would not want to inflict that on anybody else. So for vaccine schedules, adults who have never received a polio vaccine, so you've never had one, you need 3 doses. You receive the first dose, and then 1 to 2 months later, you get a second dose, and then the third dose comes 6 to 12 months after the second. Okay? For children, the dose schedule is different. They receive their first dose when they're between ages of 6 weeks and 2 months. The second dose is at 4 months old, and the third dose is between 6 and 18 months old, and their last dose, their fourth dose, is between 4 and 6. Now, you can rewind this or pause it, obviously, but I'm going to highly recommend that you take a look at the links that I'm posting at the end of this episode so that you can see, where you can get this additional information from. So you can make sure that you have the number of vaccines that you need to keep yourself and your household and your community safe. So I just want to focus one more time. I'm focusing because New York has declared a state of emergency. It's detectable in wastewater. Although it started with one man being diagnosed as paralysis due to poliovirus, we now know there's potential here for more people because it's showing up in wastewater. It's actually detectable. So take this opportunity to look and see what your vaccination status is. Definitely benefit not only your household, but your community. So in our last story that I want to talk about is the new SARS-CoV-2 animal reporting site. So SARS-CoV-2, or severe acute respiratory syndrome coronavirus type 2, which is the pathogen, the virus that causes COVID-19, is being tracked in many different ways. There's many different ways that we're trying to learn more about it. Because keep in mind, we became aware of it within a few years ago. So there's a lot we don't know yet that we're still trying to figure out. How to mitigate disease spread. How can we get more information out to people? What symptoms are we seeing the differences with the various variants? So the more we can learn, the better. And the USDA has created a website that's specifically to track animal cases, which is fantastic. It's definitely not being transmitted at the rate that is with people, but one of the concerns is that animal populations that have SARS-CoV-2 and then the variant changes or mutates, a new variant develops, and whether that could be passed back to us. Now, that's not a huge concern right now, but it may be. So we need to start tracking it to see what variants are circulating in animal populations. And this website assists with that. So I highly recommend to take a look. The link again will be posted at the end. Take a look and see, what is it? What animals have been posted? Where are those animals located? Says although the state, and this is according to the USDA, the state is important as we and researchers around the world work better to understand and combat SARS-CoV-2 and protect animal and human populations. This is one of the tools that can help researchers and public health professionals better understand COVID. This is one of many tools. I mean, we have wastewater surveillance data for SARS-CoV-2. We have COVID trends. You can look up on the CDC website and see, what is the positivity rate or hospitalization rate. You can see vaccinations rates for COVID. There's the death rate for COVID. All this information, this is another piece of the puzzle. This is to give us another idea that, okay, we see these variants circulating in human populations. Are they circulating in animal populations too? This is also great, I would say, for veterinarians as well, so that you can see what variant, if there's any known circulation within your own community. I will post the links at the end, and this is another, example to me of One Health. Like I had mentioned at the very beginning, that it's important that to keep a community healthy, that we look at the environmental factors and speak to professionals, the human health factors and speak to those professionals, and the veterinary medicine factors and speak to those professionals, because we all impact the health of each other. So thank you very much for this important new segment and portion of the public health link. Hello, welcome back to Tech Corner. So this is a moment where I feature some sort of public health or One Health technology. I briefly talk about it, of course, at the end of this episode of the public health link, you'll have the website address so that you can look up the information for yourself, which I highly recommend doing. See how you can apply it. What ways could you use this information or this new technology? So in this week's or first edition of the public health link for Tech Corner, I'm going to talk about Epocrates, a new application for both iPhones and Androids. This is actually a great way to help for patients, for clinicians, so nurse practitioners, physician's assistants, anyone that's clinically treating patients. This is a great way for you to reduce the likelihood of contributing to antibiotic resistance. So there's many, obviously, diseases, infections, and so on that we try to sample so we get an idea of whether there's resistance, right? Whether we're applying the antibiotic that's necessary. Well, this is a tool where, let's say you're in a situation where sampling this site or sending out to culture it is not feasible for whatever reason. This is a great tool to help you look at what pathogens are being seen in my area so I can get an idea of how to apply it. So this is just another tool in the toolbox to help us reduce the likelihood of contributing to antibiotic resistance. So this is the article that I actually had found out about this when I was looking to see some really great new public health technology. And this Annie Berkey does a fantastic job of walking through how you could use it. How could a clinician use this application on their phone to help reduce transmission, or reduce antibiotic resistance. So there's certain things that had stood out with me that I thought, wow, this is something that I think would be a great way to suggest this for people to look into it. If you're not a clinician of any kind, it might be worth mentioning it to your doctor, nurse practitioner, physician's assistant, whoever's treating you, and say, hey, have you heard of this? This might be a tool you might be interested in. So this new mobile phone app looks at bacterium varieties based on zip code. So fantastic way to look to see what are we currently seeing? Now, I'm not looking at it. This is, there's going to be certain pathogens this doesn't pick up, especially if you're in an area where there's culture is not done very frequently, but at least it can help you, ascertain where resistance might be an issue, right? And it looks at different bacteria found in different areas. So urine, skin, and then based on geographic location. So when I had looked at, let me pull this down a little bit further now. Hold on just a second here. So this article did a fantastic job of covering how could it be used for individual patients. So I highly recommend for you to take a look at the article. However, I also found where you could actually locate the actual application. And hold on just a second, and I can go ahead and put it on here for you. So here we have where the actual application is at. So this is getting to know the actual app for the Hippocrates. And here you have the links to get it from the iStore, the Apple Store, as well as Google Play. This does a great job of telling you how you can apply it to patient care. And how can you use it? You can use it for disease information, infectious disease treatment, alternative medicine. There's a part that's alternative medicine, as well as labs and diagnostic information. And they do provide and allow you to explore some of the features before you download it, on your phone. So I was just very impressed with this. Some argue that culturing is not done as frequently as we could be doing it. And especially in this time that we're trying to reduce the likelihood of any kind of resistance. We're seeing first and second generation antibiotics that are not always working as well as we'd like them to. So this is a great way to try to reduce the likelihood of that resistance. So I hope that you actually enjoyed this first episode and the first Tech Corner. Thank you very much. Hello, and welcome to the very first public health event segment of the Public Health Link. So every webcast is going to have a portion where I talk about some sort of public health event. That event could be geared towards community members, that could be geared towards policy members, those that create policy, I should say, within a community. It could be medical professionals, environmentalists. The goal is looking at anything that could be public health or One Health oriented, and it could be in person, webinar. I'm trying to locate ones that are either low cost or no cost, but depending on the situation, obviously I may post one that costs something as well. As I progress through this, I'm really looking at not only, I'm only going to highlight one during webcast, but I'll post for other events, so that I can highlight other ones that are going on as well. But so today I'm talking about one that's a webinar that you can participate from home. Also, it has a component of that you could go in and participate in person. So this is actually a 3-day event. So part of it you could do it both in virtual and in person, or virtual only, for those 3 days. So on September 19th, 29th, and 30th, it's a webinar called Integrating Public and Ecosystem Health Systems to Foster Resilience. It's a workshop to identify research to bridge a knowledge to action gap. So it's really looking at policyholders, community members, what can you do to create a healthy ecosystem? So this is being hosted by the Academy of Sciences, and it brings together research, practitioner, policy, community members, along with other stakeholders to explore opportunities to advance understanding of interconnections between public health and nature, and discuss how to move from knowledge to action through better integration of knowledge, policy, and practice. And this is quoted right from their website. So ecosystems form the foundation upon which society can survive and thrive. Providing food, clean water, clean air, materials, and recreation, these connections are being stressed and may have implications for public health, many of which are not well characterized. This has created a gap in our understanding of interconnected public and ecosystem health systems and how ecosystem resiliency may affect public health. So this workshop will consider the strengths and lessons learn from existing activities focused on the integration of public health and nature research. I'm going to post at the end the link so you guys can register, look into it and register for the event for those 3 days. So again, it's September 19th, 29th, and 30th. So I want to mention here for a moment and just take a step back, because I've mentioned One Health, about how the understanding that you need human health, veterinary medicine, and environmental sciences to really make a healthy environment or healthy niche, healthy ecosystem. And this kind of hits on it a little bit. So to give you an idea, if this is something you're not familiar with, the concept of how environment, can impact health, one of the things that I like to bring up is the impact of climate change on avian influenza or bird flu. You may be hearing that, and that this could be the first time that you ever heard this, about that impact. Well, avian influenza or bird flu is found in the environment in water species, specifically ducks, is typically where you find it. And it doesn't typically cause harm to them. So they're basically asymptomatic carriers. Okay. They don't, unless there's some immune system issue, it doesn't cause them harm. However, wherever they fly to or go to, and you probably all know how much they poop, they transmit that virus into the environment, wherever they could be located at. So, of course, that would follow wherever they migrate, right? We have birds that migrate from Alaska through the continental United States down to South America, from Asia, from Russia, all over the place, that migrate from one area of the globe to the other. And if you really ever look at the websites that have those migratory patterns, it really seems like our Earth is quite small when you realize how far some of these birds travel. Well, when we have a situation where climate changes, so that's either hotter or colder than what it typically trends, that does affect the migratory patterns of those birds. So what does that mean? They take their disease with them. So this is how climate change can affect the transmission of avian influenza, which is what we're going through right now. We are actually in an outbreak situation in the United States with highly pathogenic avian influenza. And this has to do with wild bird species. So the environment, human medicine, animal medicine, all of these things have to do with, making sure that when things are out of whack, it affects all of us. We're definitely all interconnected. So this looked like a very interesting webinar, 3-day webinar. I hope that you check it out. I hope to see you there. And thank you for coming to the very first Public Health Event Corner. Welcome to the last segment of the first episode of the Public Health Link. I cannot get over how much information that we covered already in this very first episode. So here, this is all the links that I will be posting to you at the end of this episode, with all the information that I've discussed during this episode. And I can't believe we're almost done. It's hard to believe to me. So on this, the Public Health Link, or we call it the PH meter, or Public Health Meter. This is where I discuss a topic that I found, and I basically rate it. So let's take a look at this for a minute. So this is the scale that I'm rating it on, okay? So the scale is so it's kind of plays on the fact of the pH meter. So whether something is acidic, neutral, or alkaline. But I'm calling it the public health spectrum, or pH spectrum, or pH meter. So what does this mean? Well, this means that if I'm saying it's more acidic, so that would be a lower number, right? Then what I'm saying, and it really, that topic or that article or that concept encourages you to do nothing. So it's not just negative, but it's lacking any way to commit or empower others. So we definitely don't want something to be acidic. If it's higher on the scale, so that's up to 10, okay, up to a higher number, alkaline, then it's saying it's total action oriented. If you read it, you're probably going to do something about it. So this doesn't necessarily mean like I'm going to make action, but it could be like, you know what? I am motivated to talk to somebody else. So it may not necessarily be me, but where am I motivated to take that information, or what am I going to do with it? If it's neutral, so like if it's up here, a neutral, then it's basically information only. And there are times that's okay, that you never know when the information is going to come in handy, or how you can apply it. And it could be a jumping off point. It could be the start of something. Wow, I've never heard of that. So information only is not necessarily a bad thing. So when I look at this, this is going to be my meter, okay? My pH meter, my public health meter. And when I talk about a subject, I'm going to give it on tell you where I rate it. Okay, so basically it's rated on action, whether you can use it, what you could do with it, who you could tell about it. Is it something you could put into play? Is it help you? Could help someone in a community, right? So today's topic for the public health, for the first installment of the public health meter, is how to make telemedicine work for visually impaired patients. Why is this important? Oh, it's incredibly important. And I have to say, this article did a fantastic job of laying out the reasons why this is important. Okay, so I'm going to show you, and again, you'll have the link posted at the end. That we go back down here. So right here, and I'm actually going to make it a little easier for you to see it. So when they took a survey of 488 adults in the U.S. who are blind, they are or have low vision, they find that of those 488, 70% of them attempted to use telemedicine, but 57% of those found they had problems with it. Now think about it in times of like with what we're going through with COVID. You know, those that are most susceptible, we want to keep out of doctors' offices as much as possible because there could be sick people in there, right? So telemedicine is something we've finally caught up to. I mean, this is the unfortunate part is it took COVID to kind of bring insurance companies caught up with so that more people have access to it, you know, so that it's affordable. But now that we have it, we need to make sure it's equitable so that people of all different kinds of people have access to it. And this is why, you know, to think that of 488 people, that 57% of those 70% who tried it had problems with it. That's a pretty big number of about 500 people, right? Who can this affect? You know, sometimes when we think about somebody being blind, we think of legally blind, but we're also talking about any kind of seeing impairment of period. So when you look at this, this could be age-related macular degeneration, which accounts for 54% of all blindness among white Americans. This could be cataracts and glaucoma, which actually accounts for 60% of blindness for all African Americans. You know, this could be glaucoma that's associated or common cause among Hispanic Americans for 28.6% of blindness. When you look at it and say in adults ages 40 years and older, 3.22 million people have visual impairment. That is a gigantic number. So when you think about the fact that we could be leaving this huge swath of people out of having accessibility to telemedicine, it's gigantic. So there may be some of you that are thinking about the ADA or the Americans with Disabilities Act and think, well, we have something that helps kind of keep things level, right? Generally speaking, for people with disabilities. I can say what I found out when I was pursuing my master's degree was just, it was mind-blowing to me because I was one of those people. You know, I really thought that the ADA helped level the playing field, you know, allowed people to have accessibility that otherwise wouldn't. Well, one of my papers was about accessibility. That's what I had written about was, you know, how accessible are we? How much, how easy is it for people to access if you have a disability to get into businesses and so on? And I found out something pretty shocking. So one of the people that I interviewed is someone who has been in a wheelchair since birth. Okay, so she talked about how the ADA has helped her somewhat, but not as much as you may think. So here's an example of it. It is more common than not that when she would visit a doctor, they would not have a scale that can accommodate a wheelchair. Now think about that for a minute. Now most of us, I can say I do not like getting on the scale, right? I mean, it's something I could easily take for granted. But that tool is very important. It can be very important. It can help a doctor determine whether someone's ill, you know, whether someone loses weight quickly or gains weight quickly. It can help decide whether treatment is working. I mean, it's a pretty basic tool, but nonetheless, it's a tool. So to think that someone would not have access to one because they're in a wheelchair was mind blowing to me. I never thought about, needing or not having access to that tool. So now when we're talking about telemedicine and you're thinking about, well, they're at home. Well, when you're talking about someone having access to that tool that can't use it because they have some form of blindness or some form of seeing impairment, that's big, especially when you talk about the numbers of people that actually have some sort of seeing impairment, right? So this article did a fantastic job, and I actually gave it on the pH meter. I gave it an 8. And why did I give it an 8 out of scale of 1 to 10? And I said it was more alkaline and acidic. Why did I say it was an 8? Well, I said it was an 8 because I think it did a great job for conversation. It made sure to bring up about the point of how many people this has a potential to affect. If you don't have an equitable service, it definitely makes it to a lot of people that have a problem with getting access to telemedicine, right? It also brought up something rather interesting, which is the fact that the Health and Human Services recently has put funding towards how to make telemedicine equitable. So the federal government's looking at what can we do? What can we do to get clinicians looking at telemedicine services that are more equitable for their patients so that more people have access to them? So it talked about who it can affect, how many can affect, and what clinicians can do. So this is primarily, although I have no doubt that this could be an awakening moment like it was for me. I was like, wow, this never even thought about this being a problem. So this could be an information moment for some, or this could be an action moment for others, especially if you're a clinician. So I wanted to also show, in case you happen to be especially one of those that this could be an action moment, in addition to this article, I wanted to show you a couple of other articles that I thought, or I should say websites, that I thought were very interesting and helpful. So this one is actually from the HHS Civil Rights website, and they actually talk about guidance on non-discrimination for telehealth. This website was really good for talking about what you can do to increase accessibility, okay? And what does the law require you to do? In addition to that, this website, which I thought was the best, was called telehealth.hhs.gov. So keep in mind, and I know I've said this before, but I think it's a really important part of this. The unfortunate part is telehealth has not been much or part of a mainstay of human health protection in the United States until COVID, because insurance companies were not paying for it. So it wasn't accessible to most people, okay? This is something that came out of COVID that has benefited people. That now, because there's an acknowledgement of, we really don't want you going in to a doctor's office if you don't need to, because you're around sick people. So now the insurance companies, they see a benefit, and that money is going in there, and the government's pushing for this to happen. It's a very good thing to push because it benefits a heck of a lot of people, everyday people. But we need to make sure it's equitable. So this is a fantastic site where you can see they break it down, what could cause limits. My focus is the fact in this particular public health meter moment, my particular angle is looking at someone that has a person with a disability and how it can benefit them. But keep in mind that could also mean someone who doesn't have internet access. I mean, there's different things that can prevent equity or prevent everybody from having access to telemedicine. So this does a really good job of breaking down where those things could go wrong. Where is it that someone might have difficulty? And what can you do as a clinician to encourage people to seek out telehealth? So what resources could you provide? So this could be social workers, useful for social workers. This could be useful for senior centers. This could be useful for nurses, nurse practitioner, doctors, physical therapists, all different kinds of people that are either in contact with patients or in contact with groups of people that really need specialized types of assistance, so they can in turn access telemedicine. So again, on this very first installment of the public health meter, or the pH meter, for this one, we talked about the telemedicine, how to make telemedicine work for visually impaired patients. And for this fantastic article by Frank Diamond, I gave it an 8 on the pH meter. So thank you very much for this first installment of the pH meter. Well, we've come to the end of the first episode of the Public Health Link. Thank you so much for coming along with me on this wonderful journey of public health information. We covered a lot today. We started off by paying tribute to those lives that were lost on 9/11 and those lives that continue to be impacted from their response to that horrible, devastating event. We talked about the declaration of emergency in the state of New York with polio. We discussed the brand new website that's from the United States Department of Agriculture on tracking SARS-CoV-2 cases among animals. We had our first ever Public Health Tech Corner, which we discuss an application for clinicians that it can help you determine what bacteria may be present in your community so that we can be better stewards, so that we can reduce the likelihood of antimicrobial resistance. We also discussed a wonderful public health event that brings together community members, stakeholders, policy members, policy creators, public health members on what we can do to create a better environment, a better community. We also did our first ever public health or pH meter, where we discussed equity in telemedicine of all things, right? I just really, the topics today were so eye-opening to me from seeing all the maladies and the diseases that the 9/11 responders and construction workers have continued to endure. To think that 400,000 people assisted on that day and the days, weeks, and months to come was mind-blowing to me. And to also think about how and what we can do to make things more equitable. Realizing that telemedicine needs to be more equitable, and what can we do to encourage everyone to have access? What can we do from either a clinical standpoint or even as a community member? Because now I know if I have someone that's in a community that I know has difficulty seeing or has other potential barriers to telemedicine, now I know where I can refer them to. Now I know how I can assist them with attaining health equity with telemedicine. So thank you so much for coming along with me on this journey. And I look forward to seeing you next Sunday at 7 o'clock. Please don't hesitate if you have any comments or questions. Of course, you can put it in the comments. But also you can email the publichealthlink@gmail.com. I hope you have a wonderful week. And I have one question for you. How can you contribute to the health of your community? Have a wonderful evening.